I'm Nuri from the Massachusetts Health Connector. I'm joined by my colleague Nikki and our MassHealth colleague Belkis, who will be presenting today's information. In attendance, we also have Melissa and Thalia from the Health Connector and Abby from MassHealth, who will be supporting with questions. Together, we are here today to share information about the health and dental coverage options available for Massachusetts residents. We'd like to take a moment to thank our community partner organizations and elected officials across the state for their support in promoting this webinar, including our partners in the state legislature and our congressional delegation. Before we get started, we do have some information about our presentation format. First, everyone's audio has been muted and video has been turned off. The presentation portion will last approximately 30 minutes, then we'll have time for a question and answer period. If you would like to ask a question at any time, please use the Q&A button at the bottom of your screen. We'll be monitoring questions throughout the session. We are expecting a large crowd, and we already have a large crowd, and several questions, so we'll do our best to get through them all and address them by themes. Also, feel free to scroll through the Q&A as your question may have already been answered. We ask that you please do not share any personal information or private health information when you ask your question, as others on the call are able to see what you write. If you have a personal scenario that you want to discuss with someone, we'll be providing contact information for the Customer Service Center and instructions on how to find help from a local assister. Lastly, we are recording today's webinar, and following the session, you'll receive an email with the presentation, so there's no need to take detailed notes. So with that said, let's get started. I'll hand it over to my colleague, Nikki.
Thanks so much, Nuri, and thank you everyone for taking time out of your day to join our presentation. As Nuri already mentioned, today's presentation is about health and dental coverage options for Mass residents who might be losing access to employer-sponsored insurance. Our agenda, we are planning to cover the following today. We'll start off by explaining the difference between MassHealth and the Health Connector. We know some of you may or may not be so familiar with our organization, so we wanted to give you that background. Then we will move into some common questions that we've been hearing as we've been hearing from folks who have been losing access to employer-sponsored insurance or from those who are completing an online application. My colleague Belkis is going to step through application requirements as well as some coverage options from MassHealth. I'll be doing the same on the Health Connector side, and then talking about when to apply. And lastly, we know we're going to be giving you a lot of information today, so we will give you some recommendations for where you can go to get local help. So let's start off with an overview of MassHealth and the Health Connector. So I am going to ask my colleague Belkis to join me, if she hasn't already, to talk a little bit about MassHealth.
Thank you, Nikki. Good afternoon, everyone. Thank you for joining us today. So I'm going to be discussing MassHealth and the populations that we serve. For those that may not know, MassHealth provides health benefits to qualifying children, families, seniors, and people with disabilities living in the state of Massachusetts. We may also help pay for these benefits directly or help pay for all or part of your health insurance premium if you do have alternative health insurance. MassHealth members do have access to doctor's visits, dental coverage, prescription drug coverage, behavioral health services, and other important healthcare services. For the focus of today, we're going to be talking specifically about individuals and families, but we also serve seniors and people needing long-term care services and supports. People that fall within the category of individuals and families are those that are under the age of 65, who are not residing in or about to go into a nursing facility. We also look at individuals of any age who are parents of children under the age of 19 or adult relatives who are taking care of or living with children under the age of 19 where neither parent is residing in the household. For our seniors and people needing long-term care services and supports, that includes individuals over the age of 65, living in the community, an individual of any age needing long-term care services in a medical institution or nursing facility, individuals eligible under certain programs to get long-term care services and supports at home, or individuals who are a married couple living in the community where one spouse is over the age of 65 and the other is under 65. Next slide, please.
So thank you, Belkis, for explaining that. And I just want to go over what the Health Connector is. So although you see us presenting together and you'll hear us talking about the Health Connector and MassHealth and how we share one application, I wanted to just acknowledge that MassHealth is a separate entity than the Health Connector, and the Health Connector is the state's health insurance marketplace. Now, we're here to offer individuals, families, and small employers access to affordable health insurance coverage. So you might be wondering, okay, so really what's the difference between those who are getting coverage through MassHealth or somewhere else, and who might be eligible for a Health Connector plan? And it's really people who don't get health insurance through their job or don't have access to it another way. So also, if someone loses access to employer-sponsored insurance, the Health Connector is an alternative to enrolling into COBRA coverage. And a lot of people who apply for health insurance coverage through the Health Connector get some sort of help paying for that coverage. Some people might even be eligible for a $0 monthly premium. So essentially no cost coverage. We will be talking a lot about health coverage today, but also want to acknowledge that individuals can purchase dental plans through the state's Health Connector. So that is something that you can do when you apply, or you can do that after the fact. Someone can come in and buy dental coverage. So we'll talk a little bit more about that. And lastly, something I want to share, but we will not be discussing today. We have a separate product line, a separate set of health insurance coverage options for small employers, specifically those with 50 or fewer full-time employees. And that is available through our Health Connector for Business platform. So if you are a small business owner and you found yourself here at this webinar, just want to acknowledge that we do have additional webinars coming up. You can go to the Eventbrite page or even to the Health Connector's website and navigate to Health Connector for Business. It's mahealthconnector.org/business, and you can get some more information there. So we're going to dive right into this information related to alternatives to COBRA, just because we know many of you might be in this position and thinking, okay, I know I'm losing a position, or I might be losing my job, and I need to get a sense of what my health insurance coverage options are. So just some health insurance terminology. When someone loses employer coverage, it is considered a qualifying life event, and it gives you a special enrollment period for enrolling through the Health Connector. So basically, if you've lost health insurance that you had, you can apply within 60 days of losing that coverage. Now, we typically get a lot of questions about what that 60 days means. So basically, if you know that this is coming up, you can certainly apply for health insurance before this happens. So within 60 days before or 60 days after the date of your loss of coverage. Now, once your special enrollment period is over, you might not be able to enroll through the Health Connector again until our next open enrollment period. So typically, open enrollment for us begins on November 1st each year. So unless somebody has some other type of qualifying life event, you don't enroll in any type of coverage, you may be locked out of coverage until next year. So that's why it's really important when you have a special enrollment period to take advantage of that. The image on the right is actually just a flyer that's available from our website, which we'll go over, which will give you a little bit more information. And just as a reminder, Nuri at the beginning mentioned that you will be getting a copy of these slides. So again, no need to take detailed notes. You will get a copy of these slides and all the relevant links that we're talking about, which will include a link to this flyer. Now, you may be thinking, okay, if I lose my health insurance coverage, is that it? Do I choose either COBRA or Health Connector coverage? And that actually isn't true. You actually have other choices. So essentially, when you lose access to employer-sponsored insurance, you are triggering a special enrollment period. So you will then, if you move over, I'm going to go through this chart. There is a 60-day election period, which basically means that after you lose that employer-sponsored insurance, you have 60 days to take action. You can either enroll in your spouse, your partner. If you are under 26 years of age, you can enroll in a parent's employer-sponsored insurance plan. You also, in most cases, have the option to continue your employer's health insurance plan through COBRA. But know that if you do that, you're going to need to pay the full premium amount. So usually people aren't aware of the amount that your employer pays for the coverage. So if someone chooses to enroll in COBRA, they're typically surprised and they say, wow, I didn't realize it was this expensive. And then, of course, you have an option instead of enrolling into COBRA, you can enroll in a Health Connector plan. So on the right here, you can see that an alternative employer-sponsored insurance plan is really if somebody does have access to a parent, a spouse, or a partner who has health insurance coverage. If that is not true, you can certainly look into COBRA, but know that the employer must send COBRA election notices within 14 days to all folks of that company after the coverage ends. We do not, the Health Connector is not responsible for COBRA or administer COBRA. However, you can look into the COBRA information a little bit more from the Federal Department of Labor's website. And again, you'll have a link to this information with the follow-up email. And then lastly, what we're here to discuss today is really looking to the Health Connector as an alternative. So you can apply for a plan through the Massachusetts Health Connector. Often you're going to find more affordable plans if you qualify for any subsidies. And again, the really, really key element to take away here is you need to take action within 60 days of that employer-sponsored coverage ending. Really think through if you have access to other coverage. Remember, you can go, let's say you have your under 26 and you living with your parents and you're looking for coverage, you can certainly go to your parents' coverage plan, let them know that you've lost access to employer-sponsored insurance and you know that you have a special enrollment period. That window will open for you to get coverage. Similarly, if you have a spouse that has employer-sponsored insurance, you can go that route as well. More recently, we've been hearing that employers are subsidizing the cost of COBRA for a number of months. So to think about that, sometimes if an employer is offering to pay for COBRA or part of COBRA for a period of 6 months, let's say, that might be a better short-term option for you as well. But know that once that subsidy ends, once those dollars end, you could, in fact, have another qualifying event, and you can look to the Health Connector. And really, at the end of the day, I think we want to say is, please don't wait until the last moment. Start exploring your options if you know that your coverage is going to be ending soon. However, for people who choose to enroll in COBRA and then decide if you are paying for the full cost of COBRA, and then decide after a couple of months that it's too expensive for you, you aren't going to be able to drop it and then come to the Health Connector for coverage. It really is a choice that you need to make before you choose to enroll in COBRA. Here on slide 8, I just want to talk a little bit more about the relationship between MassHealth and the Health Connector. So as I think mentioned really briefly, there is one application for coverage in Massachusetts, and that's an online application that's available at mahealthconnector.org. And we also have that application available in Spanish as well as Portuguese. And you, as a Mass resident, don't need to know exactly what you're applying for, right? You just know that you're applying for coverage, which is, it's good. You just enter all of the information and you can find out whether or not you and your family qualify for MassHealth, which is the state's Medicaid and Children's Health Insurance Program in Mass. As Belkis had said, MassHealth provides free or low-cost health insurance coverage to those who are eligible. And MassHealth is administered by the state and funded by state and federal dollars. Again, MassHealth is going to be based on income, age, disability, and some other factors. And you can have continuous enrollment throughout the year. So you'll hear me, the Health Connector, talking about an open enrollment and a closed enrollment. But on the MassHealth side, there is no open or closed enrollment period. And MassHealth coverage begins on the day, actually, Belkis will go over this. It'll begin on the day that someone becomes eligible. However, on the Health Connector side, all of our plans do start on the first day of each month. So conversely, the Health Connector, we're the state's online marketplace for health insurance. We, as I said earlier, available to individuals and small business. We also, if you're looking for help paying for coverage, it is also, your eligibility is also based on income and your household size, and your subsidy or the savings that you may get will vary. The Health Connector, does have open enrollment periods as well as special enrollment periods. So when things happen, you may be eligible to come on in, shop, and enroll for coverage through the Health Connector. So I'm going to move into some common questions that people have. So on the Health Connector side, yes, people are asking questions about, are there other coverage options besides COBRA? And as I described, you can in fact enroll in COBRA if that's the best path for you, but you might find that there are more affordable coverage options for you and your family through the Health Connector and MassHealth. It is not uncommon for a family to apply for coverage where the parents are on a Health Connector plan while the children are covered under MassHealth. So that is something that typically happens, and that's one of the reasons why we're able to, we have just one application in Massachusetts. Also, I mentioned that you could look into whether or not you have access to a plan through your spouse's employer, or if someone's under 26 years of age, if they can go to a parent's plan. And then lastly, something we didn't mention on the previous slide, but just also important to note, is someone can go directly to an insurance carrier and get coverage. So that is an option. The next question we hear a lot, and I had started to answer it, is, can I stop or drop my COBRA at any time and take up the Health Connector coverage? And there are circumstances when someone who is getting their health insurance coverage through COBRA can end that coverage and take up Health Connector coverage. That includes during the Health Connector's open enrollment, during a special enrollment period, if your employer is offering subsidies or help paying for your COBRA coverage and that ends, or if you are enrolled in COBRA and you've maxed out, you've reached the end of that COBRA offering, you can in fact come to the Health Connector. The next question here is, can I get help paying for my health insurance if I buy a plan outside the Health Connector? So this is really important. The answer to that is no. The Health Connector is the state's health insurance marketplace, so you can't qualify for help paying for an insurance plan if you buy it outside of the Health Connector. So if your income goes up or down throughout the year, it is it's in someone's interest to come and buy the plan through the Health Connector, because you may, in fact, your help paying for that coverage may increase. So it's good to consider shopping through the Health Connector. And the last question here is, if I get health insurance from my job, can I cancel my Health Connector coverage? And the answer to that is yes. Once, a lot of times people are using Health Connector coverage as like a stopgap measure to have coverage in between jobs. And once you have coverage, absolutely, you can call before the 23rd of the month and you can stop your Health Connector coverage. Now, Belkis, I'm going to hand this over to you for a few slides, and I will. Thank you.
Thank you. So some questions that we get asked at MassHealth that are most common questions are, firstly, do you need to live in Massachusetts to apply for MassHealth? And the answer is yes. You do need to be a resident of Massachusetts in order to apply. Now, what do we mean by that? Residency is not just specific to the home that you live in, it's also with the intention to stay and reside in the state of Massachusetts, because we recognize that not everyone's living situation is the same. Not everyone has a home to live in. So if you are someone who does not have any housing, but you are staying and residing in the state of Massachusetts, you can still apply for coverage. Instances where someone is not considered a resident of Massachusetts are those that are here on vacation or here for the specific purpose of receiving medical treatment in a setting that is not a nursing facility. The next question we get pretty often is, do you need to renew your MassHealth coverage? And the answer is yes. You have to renew your coverage on a yearly basis. In most cases, members are automatically renewed, meaning that we use the information that we already have on file to see if it still matches our records. But if we are unable to do that, you will receive a blue envelope in the mail in order to complete a renewal application, and you have 45 days to do so from the date that you receive your notice. Another question we get asked is, what happens if you get a new job or change jobs? It is your responsibility as an applicant and a member of MassHealth or the Health Connector to report any changes to income within 10 days. Oftentimes, that's usually like within 1 or 2 pay periods, depending on the frequency in which you get paid. And you can go online into your application and update your information yourself, or you can complete a job update form that's available on our MassHealth website and submit it to us. And then what do you do if income changes throughout the course of the year? Again, it is in your best interest to report any changes to your application throughout the course of the year. You have the ability to do so online. And if you're having any issues with that, you can always call and report those changes over the phone, complete it online, or submit some forms to us in order for us to update your information. You can call our customer service line at 800-841-2900 with any and all application updates. Next slide, please. So now we're going to talk about reporting this income. As you're going through the online application, if you're doing it online, it is important that when you are going through your application that you answer according to the month in which you're completing the application, meaning as of today, what is your current state of your income and other members' household income as you're completing the application. On the slide, you can see a screenshot of what that screen looks like when you're reporting your income. And as you can see, you have several options to select from. Make sure that you are completing it specific to the individual that you're reporting income for. So if you are someone that has a job, is self-employed, you have the option of selecting several income sources if you have multiple sources of income. Make sure that you are checking all the boxes for yourself and your household members. And if you are currently not working or not receiving an income, you can select on the bottom of the screen, continue with no income, and you can move forward in that regard. And just a reminder, this online application is for both MassHealth and the Health Connector. Oftentimes the way it works is that it'll see if you are eligible for MassHealth first, and if you are not, then it will move you into the Health Connector plans. Next slide, please. So if you are an individual, what we've been hearing as of late is that people are, as they are losing their jobs, they may be offered some sort of a one-time payment or severance payment. So how you would report that income is by selecting other income, because it's not going to be a one-size-fits-all option. So you would select other income, you check off the other box, and then you would indicate your income source. So in this instance, we would say severance payment. You type in severance income, and then you will select if it's a one-time only option. So if you're getting it as a lump sum, and that's not just specific to severance, another example is if you have lottery winnings, that's another one-time only payment that you will get most often. You select one-time only, and then you indicate how much you got for the one time. You are also required to select the month and the year in which you receive that income, because it's specific to that point in time. And always indicate the amount as a gross amount, meaning before any taxes are taken out. Next slide, please. So once you go through the income for each of the household members, you're going to come to the yearly income screen, where the system will calculate what your yearly income is based on the information that you provided. Now, keep in mind that not all income sources are things that you get throughout the course of the year, or it may not be an accurate portrayal of what you are receiving for the year, because maybe you're in a job or your income changes throughout the course of the year, and it's not going to be an accurate portrayal of what you are receiving by the end of 2025. So you do have the option of saying that you do not agree with the income that the system generated for you, and then you would provide the system what your yearly income is for this current year. So if you had job changes throughout the course of the year, you can indicate what your yearly income will be based on the working income or income that you did receive for this year. And keep in mind that this is something that you're going to have to do every time you're reporting a change, in particular when we're talking about income, because if you don't have employment today and you get employment a month from now, the system's going to calculate it based on what you're indicating for that income source, almost as if you're receiving it for the year. So it's something that's really important to pay attention to, because you want to make sure that the most accurate information is listed on your application so that you can get the best benefit that you're eligible for. Next slide. So now we're going to talk about application requirements. These are the things that you need to know that you have to complete in order to be eligible for one of the two programs. So as it was mentioned previously, it is one application that does a determination for two different programs. So again, oftentimes you will, based on the information provided, be seen for eligibility for MassHealth first. And if you're not found eligible for MassHealth, then you will be moved into the Health Connector and be able to shop for a plan. So this is just what the slide looks like, of what you're going to see when you go onto our website once you're applying. It's really easy for the most part, but we do have support available to you if you're having any difficulties navigating our application. Next slide. So who should apply? Members or applicants that live in the state of Massachusetts, are a U.S. citizen, U.S. national, or otherwise lawfully present in the United States, and that also includes those that may not have an immigration status. You can still apply. If you are an applicant that has Medicare or other public health coverage, you still may qualify for a benefit. If you are receiving Medicare, you may qualify for both Medicare and MassHealth, where we can help offset some of those Medicare costs. If you are offered affordable or comprehensive health insurance from an employer, you may still qualify for MassHealth, even if you have insurance, because we do offer additional programs to help assist with some or all of your healthcare premium, depending if you are eligible. And you can also apply if you do not have any health insurance. So it is really a great option to apply anyway, just because you never know if you could get MassHealth as a secondary insurance. So I always encourage people to still apply and just see. The worst thing we can say is you're not eligible. Next slide. So those who should not apply. If you are not living in the state of Massachusetts, you should not be applying for coverage. If you are visiting here for personal pleasure, such as vacation, or you're only here to receive medical treatment for a short period of time outside of the skilled nursing facility, you should not be applying for coverage. Some things to consider as exceptions: if you are eligible for other comprehensive health insurance, including Medicaid or Medicare, you will not be eligible for Health Connector. So if you do have alternate health insurance, you wouldn't be eligible for a Health Connector plan. If you are an individual who is in jail or prison, you can apply for MassHealth prior to release, but you are not eligible for MassHealth or the Health Connector while you are actively incarcerated. Next slide. Who should be on your application? We've gotten many questions before about who you should include depending on the ages, the relationships amongst household members. So I'm hoping that this will help clarify some for some of you who you should include on your application. So the application for MassHealth and MA Health Connector should include people within your household. Please tell us of the household members that are living with you. If you file taxes, we need to know about everyone that is listed on your tax return, even those that are not living in your household. So if you have a household and you're filing taxes and you have members on there that you are claiming as dependents, or spouses that you are in the middle of a separation or a divorce, but you're still filing taxes together, we would still need their information because they're listed on your tax return. If you do not file taxes, you may still be eligible to get MassHealth, Health Safety Net, or the Children's Medical Security Plan if you qualify or are found eligible. So here's a list of who you should include: yourself and your spouse if you are married, any children under the age of 19, and that means biological children, adoptive children, or stepchildren, your unmarried partner who lives with you, who you share a child with. So essentially, it's a domestic partner that you share a child and are living together. That person should be included on your application. You should also include any children under the age of 19 who live with you, or anyone that is listed on your tax return, even if they do not live in your household. You also need to include anyone who is on your tax return, even if they don't live with you, as well as individuals who are living with you that you take care of that are under the age of 19. Those who you should not include on your application. So this is going to get a little confusing and I do apologize, but you should not include a domestic partner if you do not share children. If you are just two adults over the age of 19 and you don't have any children together, you should not be including your partner. That obviously will change if you do end up having a child together and you are all living in the household. That is the caveat to that circumstance. You should also not include any unmarried partners, any of your unmarried partner's children. So again, if you're just living with your partner, but you don't have any children, any mutual children, you shouldn't be including your partner's children, even though they all live in your household. You should not include your parents who live with you if they file their own taxes. So this is speaking to young adults who may still be living with their parents, but are over the age of 19 and their parents are not claiming them as a dependent on their taxes. As well as if you are an adult and you're living with your older parents, think those that are over the age of 65. If they file their own taxes, you do not need to include them on your application unless you are claiming them as a dependent. And another individual that you wouldn't include are any adult relatives who you do not claim as dependents on your tax returns. So what do you need to apply? It may seem a little bit overwhelming, but these are just things that are helpful to you as you're completing your application, and that is both online as well as via paper. If you have Social Security numbers, we ask that you have that information available as you are completing your application. And if you do not have one available, you can still apply. You would just indicate that you do not have a Social Security number and the reason for which you do not have one. Make sure you have available any recent pay or income, and that's including any pay stubs, tax returns, a profit and loss statement for those that are self-employed. Try to have all that information available so that it's easy for you to navigate the application and just plug in the numbers. You may also want to have available any proof of address. Some examples of that are a copy of a lease, a utility bill, a mortgage statement, a deed if you're a homeowner. You may also want to have available your immigration documents if you have them available. If you are a US citizen, you can have your birth certificate or passport available. For anyone who has a legal immigration status, just have the different cards or forms that you are provided by the immigration office. And for those that do not have an immigration status, you're still eligible to apply. You would just indicate that you don't have a status at the time of application. You also want to include any health insurance information that you have available. If you have Medicare, employer-sponsored insurance, have COBRA, you want to include that information as part of your application because at least through MassHealth, we have some programs that can help offset some of the expenditures affiliated with employer insurance. So just have that information available. Keep in mind that when you're completing the online application, we may not ask you to submit all of the documentation that we are providing you as far as this list is concerned, because we do try to electronically verify information. But if at any point throughout the course of the application we're unable to verify your information, we may ask for additional supporting documents that you would have to send in to us or upload to our application. Next slide. So what is the best way to fill out the application? Please make sure that you are completing all the questions for all applicants listed on the application. The reason why we ask this is because if it is complete, we'll be able to process your application, in particular when we're talking about a paper application. If you don't answer all the questions, it may delay your application process. So please make sure that you're answering all of the required questions on the application. When you are reporting your income, make sure that you're including gross wages, weekly hours worked, and the pay frequency. Make sure that it's everything prior to any taxes or payments into 401ks, things of that nature. We just want to have the most accurate portrayal of your income at the time of application. If you are not earning any income, please do not write NA or not applicable, because that can, again, delay your application process. If you are not receiving any income throughout the course of the year, just write on the yearly income line the number 0, or you can even write out the word 0 on the line, because then we know that you have not received income for this year. Make sure that you are signing, printing, and dating at the end of your application. Some different types of signatures that we accept are e-signature if you're doing this through a PDF. We also accept e-signature on paper applications as well as online applications. If you are completing your application over the phone, your signature is being recorded verbally through a recorded line, because you're then giving verbal consent to the accuracy of the application itself. If you need any help applying, you can contact an enrollment assister or go to one of our MassHealth enrollment centers, and someone will be able to assist you in completing your application or answer any general questions that you may have about the application process. After you submit your application, something that you need to keep in mind is that we may ask you for additional information. So please make sure that you are checking any and all of your mail, because we may need you to submit documentation to us, and you may not know it if you don't respond or open the mail that you're receiving from us. I know sometimes you can feel overwhelmed with all of the mailings that we send out, but it's really important to make sure that you are checking your mail to make sure that you do not miss anything, because it may lead to adverse action later on, such as termination of benefit if you don't respond to things that we are asking you for. And make sure that if we are asking you for documentation, that you are submitting it on time or as soon as possible, just so that you don't lose benefits throughout the course of the year. Next slide. So what happens after you are approved for MassHealth or the Health Connector? So once we receive all of the information, we will make a decision and let you know what you are found eligible for. If you are approved for a benefit, we will let you know which program you qualify for, whether that is a MassHealth benefit or eligible to select a Health Connector plan. If you're approved for MassHealth, some of the things that you may receive are: first, you'll get a blue MassHealth ID card showing your MassHealth number, and that card you can present to any and all of your doctors. Depending on the type of MassHealth benefit, you may need to select a health plan through us, and you can go on to MassHealth Choices to see what your options are in your respective area, so that you can select a plan that best suits you and all of your doctors and specialists take. After you select a health plan, you are going to get a white ID card for that plan. So make sure that you have that available when you're going to any of your doctor's appointments. Make sure that you are reporting any changes that happen throughout the course of the year for your application within 10 days. And that's anything from job, income, household size, if you've moved, or any immigration changes. That's something that you do need to report within a timely fashion to make sure that we're giving you the best benefit that you're eligible for. And then make sure that you're renewing your coverage every year, because if you don't, you could potentially lose your benefit. So with that, I'll pass it to Nikki to talk about the Health Connector.
Thank you, Belkis. So if you're approved for the Health Connector, just know that you're going to be able to compare plans directly on the online application in the portal. You're going to see the carriers in your region, the premiums that are associated with those plans, and they're going to be specific to you. So it's going to be what is available to you. The application has taken into consideration the savings that you're eligible for. And before you choose a plan, you have the ability to find out if a particular doctor or a hospital, or even if you're taking a certain medication, You want to be sure that you are, if you want to keep those relationships and continue that medication, you want to be sure that the plan that you are enrolling in is in fact connected with those networks and will have your medication. Now, once you compare your options and you decide, you're going to need to select the plan. Essentially, you're going to see a shopping cart. And in order to start the plan and you want to check out of that shopping cart, if you owe a premium, you need to make a payment by the 23rd of the month for coverage to start the first day of the following month. So we'll talk more about this, but just wanted to acknowledge that the shopping process is slightly different for both the Health Connector and MassHealth. Which is a great segue into our coverage options. Belkis, I just wanted to give you a break for a moment. If you want to talk about some of these coverage options on the MassHealth side, that would be great.
Sure. So I'll try to go through this briefly just to be mindful of time. So for MassHealth, individuals and families are eligible for several different MassHealth benefits. The one that people are most familiar with is MassHealth Standard. MassHealth Standard coverage covers a full range of healthcare benefits, everything from health, dental, vision, and behavioral health services, as well as other options as well. But those are like, in terms of your healthcare benefits, those are like the main ones. Common health is available to those that have disabilities. So if they are not eligible for MassHealth Standard and you're an individual with a verified disability, you may be eligible for Common Health, which again covers the same range of services as MassHealth Standard. The difference is that you may be assessed for premiums depending on your household's income. So that's something to keep in mind. Followed by Care Plus, and that is available to adults who do not qualify for standard, and also typically adults that do not have children. So that's why they get Care Plus. It still covers everything that's the same. The difference is that they are just a single individual without any children, but it'll still meet all of their healthcare needs. Followed by MassHealth Family Assistance, and this offers a broad range of healthcare benefits to certain children, adults, including those that are non-citizens who may not be eligible for standard. So these 4 benefits are considered a comprehensive benefit, and you may have the opportunity to select or enroll in a health plan through us. And that's assuming that you do not have other health insurance. And then in that instance, we would act as a secondary. And then the next 3 coverages that I'm going to talk about are not considered a health insurance for tax purposes, so just keep that in mind. First, we have MassHealth Limited, and that provides emergency health services to those who under law have an immigration status that keeps them from being able to access more comprehensive services. Followed by Children's Medical Security Plan, which is a coverage primarily for preventative medical or dental services for children who do not have other health. I'm sorry. So for the Children's Medical Security Plan, that is for children who do not have other health insurance and are not eligible for any of the other benefits. Health Safety Net, which is most commonly known as free care, is only covers certain services that are received within an acute hospital or community health center. So if you are uninsured or underinsured, you may have Health Safety Net as an option. Next slide. So I'll pass this back to Nikki to talk about Health Connector plans.
Thank you, Belkis. So I just wanted to explain the Health Connector plans a little bit as they're different from MassHealth. So all of the plans that are sold through the Health Connector are known as qualified health and dental plans. So that basically means that all the plans meet state and federal coverage standards. So we also have other plans that are known as health plans with advanced premium tax credits. So these are the way in which the Health Connector can provide savings to individuals. So if people qualify for tax credits, these reduce the cost of monthly premiums. So these are dollars that you'll get ahead of time that essentially, these are dollars that are sent to the health insurance carrier during the year in their advance. And essentially, these are dollars that you will reconcile on your taxes at the end of the year. Now, for connector care plans, these are health coverage plans for individuals in lower income ranges who meet other Health Connector eligibility requirements. And again, as I mentioned before, people might qualify for a low or even a no-cost health insurance coverage. And as an example, I just want to share some information about the income limits. So connector care programs are comprehensive plans. They just have much lower premiums and copays. And real importantly, there are no deductibles. So for an individual, for one person, the income limit for connector care is $75,300 for this calendar year. And as another example, if you have a family of 4, and you're making less than $156,000 for calendar year 2025, you may also, in fact, qualify for the Connector Care program. Now, you might be wondering, okay, well, when can I apply? What are the deadlines? What are the things I need to keep in mind? And I, again, want to be really mindful of timing. So I think I'm just going to very, very briefly explain that for MassHealth, essentially, if you need coverage, you just apply. For the Health Connector, we have enrollment deadlines. As I mentioned a while back, open enrollment is from November 1st through January 23rd. So essentially, when you need the coverage, we really want to encourage you to apply. You don't know what, in fact, you're going to qualify for, so it's just a good idea to do that. If you have a qualifying life event, that's what opens a special enrollment period, and that's what allows you to enroll or change your health insurance plan outside of the Health Connector's annual open enrollment period. So again, things like losing access to employer-sponsored insurance, or if there's been a change in your household size, income has gone up or down drastically, immigration status has changed, etc. Or let's say you just moved to Massachusetts. These are all things that would open a special enrollment period. Remember, if you have a qualifying event, you want to let us know within 30 days of that happening, but you're going to have 60 days from the date of the qualifying event to select a new plan. During these timeframes, you still are required to, if you owe a monthly premium, you're still required to make that payment by the deadline. And I won't spend a ton of time here because you are going to get these slides. So I know that both Belkis and I have mentioned that there are many ways in which you can get assistance. So you'll get the information about the MassHealth customer service as well as the Health Connector's customer service lines. Also, MassHealth has these walk-in enrollment centers, and you can either schedule an appointment or you can go in as a walk-in. So there are a number of locations listed here. Again, you will get all of this in your follow-up email. And I think we both have talked about in-person support through enrollment assistance. These are organizations and people that have worked closely with the Commonwealth, both MassHealth and the Health Connector, to become certified assisters. So these folks are either certified navigators or certified application counselors, and they can help you with the application, they can help you troubleshoot, and they can help you even after you've enrolled in health insurance coverage with any support you might need. If to find somebody in the area in which you live, and also if you are looking for someone who speaks language other than English, maybe a language that you speak, you can see that on the listing if there are any language support options in that organization. And we apologize. I know we had a ton of information, and I see that my colleagues were answering a ton of questions. So perhaps I'll look to Nuri, if there are any questions that you want us to cover, any particular themes? I know I was trying to answer some questions too for people, so hoping those responses made their way over.
Yeah, of course. Thank you, Nikki, and thank you, Belkis. Just want to take a moment to acknowledge all the questions that we have received and everyone who has taken the time to join us in this webinar. And I know that our colleagues continue to work on the back end there. But I guess if we could just address two large themes that we've seen come in during the last hour or so, would be going back to COBRA. So just reminding folks whether or not they can drop COBRA coverage at any time, when they should be applying for other coverage options, very high level.
Sure. So when it comes to COBRA, the rules are essentially if you have chosen to enroll in COBRA, you aren't able to drop that COBRA and then come to the Health Connector unless you meet some type of unless there's a special circumstance. One of those special circumstances is, let's say you enrolled in that COBRA and your company was providing, or your former employer was providing, a level of monetary support. If that subsidy ended, that is a circumstance where you could, in fact, get a special enrollment period and come to the Health Connector. If you enrolled in COBRA and you were in that for 2 or 3 months, 4 months, they weren't offering you any type of support, you can't necessarily just drop that coverage and then come to the Health Connector unless it's our open enrollment period. Something I do want to mention, because I don't want someone to feel like they are stuck and can't get any support if they in fact need it, is the Commonwealth does have an Office of Patient Protection. And I guess I would just want to ask if one of my colleagues could put the OPP's information. I don't know, Nuri, that you're going to be able to do that the way.
I don't think so. Yeah, we don't have a chat available, so unfortunately we cannot drop that information, but we can send it as part of the email,
We
right?
can send it in the follow-up email. Great, great, great. I wasn't sure whether or not you could do that. All right, so we will get you that information because I don't want anyone to feel like they're stuck. And I guess I look to Belkis to just say, like, I'm sure you would agree with this. If someone needs coverage, apply. You don't know what exactly your situation is. You don't know what you're going to qualify for. I think it's in everyone's best interest to complete the application, complete it as accurately as you can, and then let the system make its determination about what it is that you and your family members may be eligible for. And if you have any questions, you can contact either customer service or even a community partner to get some additional help. Belkis, is there anything else you want to add?
No, I completely echo what Nikki says.
Yeah.
And then I guess another common thing that we saw here in the Q&A is just regarding questions about household composition and who should be listed on the application, whose income, etc. I know that this is a lot more than we can cover in the next 2 minutes, but if there's any, again, high-level points there, Nikki or Belkis, that you can share as to when it comes to, who should be listed on an application, I welcome that opportunity.
Yeah, so I feel like Belkis went through a really good detailed slide. You know what, Belkis, I'll try to go back to that slide if you and let you talk. Hold on, I'll go back to that and you do your thing.
Sure. So when it comes to household composition and who you should include on your application, essentially, let's start with taxes first. So if you are a tax filer and let's say you are filing either on your own or with a spouse, make sure that you are including yourself and your spouse, and then any dependents that are listed on your tax return. So you want to make sure that you include all of those individuals, even if they do not live in your household. Because they are factored in as part of your eligibility. If you do not file taxes, make sure that you are including yourself, a spouse if you have one, and any children, whether they are your biological children, stepchildren, adoptive children, or if you are a guardian or caretaker of any children under the age of 19, make sure that you're including them. If you have a spouse that is over the age of 65 and you yourself are under the age of 65, you still have to include them on your application. If you, in that same scenario, over 65 and an under 65 person, have children, everyone needs to be included. So please make sure that when you are doing your application, and also if you have any questions, you can always call and ask, because we recognize that not everyone's household is the same, but those are the highlights of who you should include. And if you have children and the person that you had children with is not your spouse, you would still include them because they are also responsible for those kids as well as yourself and is part of your household. So I hope that helps. And again, call if you have any questions because someone can really walk you through your own specific scenario and can help you navigate the process.
Thank you, Belkis. I just want to echo that statement as we do still have a couple of questions that fortunately we are at time and we won't be able to get to them, but they do seem to be very specific scenarios. So again, just to echo Belkis' point there, call, reach out, find local help. Nikki, if there's anything else that you would add there before we wrap up our webinar.
No, just know that you can, actually, yes, there is one more thing I want to add, which is please don't hesitate to reach out, even if you've started the application and you've gotten to a certain point, and let's say you've gotten frustrated or you've gotten confused, it's okay. Call customer service or call a local assister. Once you give them permission, they can access the application. They can pick up wherever you left off. So you're not starting over, and then they can help you get across the finish line. So just really encourage you, no reason to go without health insurance coverage. If you need coverage, reach out to us. We're here to help you. And also we will send additional details. We'll look through all the questions that we weren't able to get to. If there are any other ways in which we can answer those, we'll include those as well in the follow-up email. So a big thank you for everyone who stayed. I know we're over time. Thank you for staying and joining us today at lunchtime. And then also a big thank you to my colleagues for answering what I know were a ton of questions on the back end. So thank you all so much. And until next time, actually, Nuri, I think I was doing your closing. I will let you do the closing.
No worries. You were doing great, Nikki. And then just a reminder to folks that we will be sharing the presentation and links. Unfortunately, we are not able to send out the Q&A, but again, you will have the rest of the material. So thank you all for joining. Thank you, Belkis. Thank you, Nikki. Thank you for joining our webinar today from the Health Connector and MassHealth and all of our sisters. We wish you well. And until next time, as Nikki said.